Ear infections. Get a lot of questions about ear infections. So understanding what causes them, I think, is one of the biggest things that people need to know. The conditions of the ear, the anatomy of the ear are definitely going to play into that, right? The ear canal, especially with our floppy ear dogs, it's going to be dark. Anything with the body on the surface temperature and being in that canal is going to be warm. And there's moisture in there. So those are all the three things that these little microorganisms, both bacteria and fungus, love and need to thrive. So one of the first things that we see is very commonly associated with getting exposed to some type of moisture. Did the dogs go swimming? Were we out playing with the kids with hoses? And those ears in the inside of the ear gets wet. Over a period of time, all of a sudden we see our dogs start to shake their head. They may be scratching at their ear with their hind paw. They may be trying to rub it. And you see them, you see the behavior change. That's a great indicator. Take a look at your dog's ear. Do we see redness on the outside of the pinna, which is the outer portion of the ear? And looking down, do we see any inflammation in there? Is there any excessive debris or discharge? And then are we seeing any type of inflammation on the ear pin you'll start to see almost like a cobblestone look where we'll get a bunch of these, which is inflammation, but that's a great indicator where the surface appearance of the ear has changed. Looking down into the ear now, are we starting to see that canal starting to narrow down due to inflammation? There's other influences to the ear infection. It is under the category of dermatology. And so as we know with any type of skin infection, especially in our canine, the diet can play a huge role in whether or not our dogs are getting ear infections, because if our dogs are allergic to something in the food, usually the protein source, they can be systemically inflamed. And that inflammation is one of the things that allows these microorganisms to take advantage of the situation. Not always is it just one organism. It can be a bacterial infection and then get a secondary fungal infection, or vice versa. They get a yeast infection down in there first. It causes irritation on that skin surface. The dog goes and scratches, now delivers bacteria that is on that paw with the nail, scratching that skin surface, getting through that first defensive barrier, and now that microorganism is implanted in there, and we get a secondary bacterial infection. So many times with our treatments, with topical treatments, you will see a mixture of usually three different things. We'll have an antifungal, we'll have an antibacterial, and there'll be something there to help reduce the inflammation. Because if we can reduce the inflammation, and there, one, it stops with some of the pain and the itching, which is further exacerbating the situation, but also reducing the inflammation allows the system to be more effective at traveling to that point of the source that is causing the infection. If we can reduce the inflammation, now from what is in the bloodstream has less distance to travel to reach that microorganism and get rid of it. So, and depending on the severity of the infection, your veterinarian may prescribe an anti-inflammatory orally. They may prescribe an antibiotic. They may prescribe some type of an ear flush, and the ear flushes vary across the board. Some of them are very heavy with an antifungal. Some are very heavy with different types of medications that can be antibacterial. They may have different types of pH to help dry up the area or make the pH not as habitable to these microorganisms growing. The biggest thing with the rinse, besides kind of being a topical application of medication, it helps remove that debris. Because if we have a bunch of debris on the surface, skin surface right here, and we have the infection on that skin surface, and now there's debris over the top of it, medication that is applied is not going to reach that microorganism that is infecting and irritating the skin. And so getting rid of that debris, removing those layers that are blocking that, allows direct contact with the skin surface to help eliminate that infection. So left untreated, ear infections can get really, really bad. One of the things that we see commonly associated with an ear infection was called an aural hematoma. Aural, not oral, aural as in A-U-R-A-L. That is the outer portion of the ear, the pinna, especially in our floppy-eared dogs. When they're shaking their head because of the irritation, if watching in slow motion, that ear pinna will snap like a whip back and forth. And that snapping motion causes that skin to separate, and not all the capillaries in there to bleed, and we get a bunch of fluid in the ear. Very similar, you see grapplers and wrestlers and Brazilian jiu-jitsu tacticians grab them from rubbing their ears, and you'll get that big swollen cauliflower ear. That is the exact same thing that is occurring here. That needs to be treated and drained, likely stitched and sutured together to prevent it from refilling, because if you do not treat that, it will turn into a rock hard calcified chunk in the ear. One of the other things that we can see, ear infections that will cause it to get worse, is severe inflammation, even a ruptured eardrum, and can cause permanent damage to your dog if left untreated. So when you see any signs and symptoms of that changing behavior, that smell, that odor coming from the ear, your dog scratching at it, acting painful, avoiding you touching the head, or moaning and overreacting to touching the ear, are all signs that we've got a brewing ear infection and you need to get it checked out.